our Chief Medical Director, Dr. Aurobindo Ray, present all doctors, ANOs, my colleagues, ladies and gentlemen. This year, in 2013, International Nurses Day celebration the theme that is the closing the gap with Millennium Development Goals. So we have to know that what is closing the gap before we are going to celebrate this occasion, auspicious occasion. So a stronger emphasis needs to be placed not only on the discovery of the drugs, not only on the discovery of the diagnostics, but we have to be stressed. We should be close between the evidence to action. Because there is some traditional conflict between the seniors and the juniors. So this year, International Nurses Day thought the theme that closing the gap. That means we have to break the barrier. Along with that, we have several Millennium Developmental Goals. So what is the goal 1? Goal 1 stressed upon the eradicate extreme poverty and hunger. Percentage in the extreme poverty dropped from 33% in 1990 to less than 20% in 2004. Second goal is our enrollment grew from 80% in 1991 to 88% in 2005. That is the actual primary education for all. It doesn't reflect whether children attend regularly and statistics not available in many conflicts. More than 100 million children remain out of the school. So it is the nurse's responsibility to close the gap. Goal 3 is promote gender equality and women empowerment. We still know that there is the gender discrimination. But what I feel that no characteristics should be stamped as a masculine or stamped as a feminine. What is we should develop the respect and understanding between the genders that only can to some extent prevent the gender discrimination. Goal 4, that is reduce the child mortality, reduced from 13 million to 9.7 million. Goal 5, that is improve the maternal health. Still more than 5 lakhs childbirth related deaths each year. 10 poorest countries is one and 15 women die in the childbirth. Goal 6, we have to discriminate. We have to prevent the number of AIDS deaths and malaria reduced, but more funding needed. Goal 7, that is the environmental pollution. We have to ensure environmental sustainability. Carbon dioxide emissions continues to rise, so deforestation continues at an alarming rate. Goal 8, that is the most important goal. We have to develop the global partnership for development. Couple of days back, there was one in our session, that is biomedical waste segregation. One class was taken. But what I mean to say, biological waste segregation is a part of infection control, but it is not at all the whole infection control. For the infection control, the hospital has to develop some policies, some protocols, because there are different infections in the different department. So according to the department, the hospital should develop some policies. Like one patient may get saline for 4 days continuously. So 4 days will I continue with the same saline set, or I will reduce it in 124 hours? Will I continue the IV infusion with the same gel go for 7 days, or I will change in every 3 days? That is the question. The hospitals who are accredited, they have the infection control policy and protocol. They are going with the protocols. So we should also develop fair and transparent protocol for our hospitals also. So what I request, that you think your window should be open for thinking. And if you open your window, then sky is only the limit. Thank you.